Hey everybody, and welcome to Anxiety 101, this month's monthly webinar. I'm going to get started right here, so let me just get out of your face and we will get going here. Let me just check on something, make sure this is recording for us. Yes, it is. Okay. Anxiety 101. Now, according to the Oxford dictionaries, anxiety is defined as an unease, typically about an imminent event or something with an uncertain outcome. Let me repeat that for you. Anxiety is defined as a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. And everyone experiences this at some point. In fact, anxiety is somewhat normal reaction to stress, as it can initiate our fight or flight response and keep us alert to our surroundings. However, it is important to learn the difference between feelings of anxiety and a true anxiety disorder. There are several different anxiety disorders, but all have defining characteristics that make their diagnoses possible. A few of the key differences that are considered when differentiating experiencing anxiety and having an anxiety disorder. 1, intensity and the length of time. While it's normal to experience anxiety in uncomfortable situations, it is usually isolated to a specific event. Whereas those with anxiety disorders produce an excessive emotional response on more occasions than necessary. For example, if someone with an anxiety disorder is made aware of a stressor, they would experience anxiousness several weeks beforehand. Their anxiety will be disproportionately to the given stressor and may even stay present for the following weeks. Another key difference is the extent of the stressor. Certain events, such as an audit at your job, a difficult exam, an upcoming interview, or any other high-pressure changes can provoke anxiety. However, those with an anxiety disorder experience anxiety even when the stressor is not necessarily present. For these people, even small tasks may give rise to an anxious response. Number 3 is the impairment. Anxiety disorders can significantly affect the quality of life. It is unlikely that someone who just experiences occasional anxiety will have trouble following out their regular responsibilities, such as going to school, working, paying bills, or even going grocery shopping. In turn, those with anxiety disorders truly avoid anything that they believe may make them feel anxious, which is often hard to even identify in the first place. And fourthly, when it comes to diagnoses, is the physical manifestation. Anxiety can manifest in many ways, some psychological and some physical. I will be going over these in detail, but some physical symptoms that often accompany an anxiety disorder include lightheadedness, headaches, trouble breathing, and nausea. Next, I will be introducing different anxiety disorders and what makes them different from one another. General anxiety disorder is the most common anxiety disorder and affects approximately 6.8 million adults in the United States. There is currently no known cause, but evidence suggests that family background, biological makeup, and life experiences all play a role in the development of this mental illness. Those with this disorder display excessive worry for an extended period, often without an identifiable trigger. General anxiety disorder, or GAD, GAD, presents an array of symptoms depending on the person, but many of the common ones include restlessness, fatigue, brain fog, memory issues, irritability, muscle tension, and sleep problems. GAD is diagnosed when there is a persistent difficulty to control worry for at least 6 months and the presence of at least 3 of the symptoms above. This disorder comes on gradually and can develop throughout life. However, the highest risk age group includes children and young adults. This chronic state of worry can affect a person's ability to maintain a healthy social life, employment, and fulfilling life. Panic disorder has a more specific trigger, but is just as persistent as generalized anxiety disorder. Panic disorder, or PD, is associated with intermittent and unexpected sudden periods of intense fear, also known as panic attacks. The disorder develops when one is limited by their disabling fear of another attack occurring. It is no surprise that panic attacks do present the physical manifestations of fear. Some include heart palpitations, raised body temperature, shortness of breath, and trembling. Often someone experiencing a panic attack will insist that they are experiencing something purely physical, such as a heart attack. The symptoms of this disorder include repeated and sudden panic attacks, feeling entirely out of control during an attack, intense worry that another attack will occur, and avoidance of place or events where panic attacks have happened before. Those who suffer from panic disorder shape their lives around trying to avoid a future attack. However, this fear is usually not justified by a specific trigger. This creates a difficult cycle of trying to avoid something that occurs rather unexpectedly. Social anxiety disorder is considered a phobia or an extreme and irrational fear. This fear stems from social or performance situations with the possibility of feeling judged, embarrassed, or rejected. This is associated with feeling self-conscious and highly anxious in anticipation, during, and after social interactions. Those who suffer from this disorder find difficulty in leading conversations, presenting in front of groups of people, and making new friends. With social anxiety disorder, worry can consume someone for an extended period of time before an event, It can also present physical symptoms such as trembling, nausea, and a rapid heart rate. Over 15 million adults suffer from this phobia-based disorder, and it is most commonly present in teenagers. However, in the past, social anxiety disorder has been wrongfully written off as just shyness. But with a better understanding, it is finally receiving the attention it deserves. Post-traumatic stress, of which we've all heard a lot of, the post-traumatic stress disorder, commonly known as PTSD, is an anxiety disorder that develops in response to experiencing a traumatic event. The normal response during a scary or dangerous situation is to feel fear. This fear propels reaction to either defend against or avoid the given danger. This is commonly referred to as our fight or flight response that's facilitated by our parasympathetic nervous system. PTSD differs from a natural reaction to trauma by extending that stress and fear even when the person is not in any danger. Not everyone that has experienced a traumatic event develops PTSD. However, symptoms may begin as early as immediately after the event or can take several years before they develop. Overall, the course of this illness varies, where some people experience relief within 6 months, while others experience chronic difficulty. The DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders, is a published classification of mental disorders used by mental health professionals in the United States. The DSM-5 categories anxiety disorders into 3 groupings, including 1. Anxiety disorders: generalized anxiety disorder, panic disorder, social anxiety disorder, separation anxiety disorder, selective mutism, specific phobia, and agoraphobia. Second category, obsessive compulsive disorders. That includes OCD, body dysmorphic disorder, hoarding disorder, and excoriation disorder. And the third category, trauma and stressor related disorders. PTSD, reactive attachment disorder, disinhibited social engagement disorder, acute stress disorder, and adjustment disorder. There are many different recognized anxiety disorders that all vary in severity. However, they are all serious conditions for those who suffer from them. Anxiety manifests itself in a number of ways, depending on the disorder and the person experiencing it. While these are considered mental illnesses, they often have physiological effects as well. Up next, we will touch on the various emotional, behavioral, and physical consequences that are attributed to anxiety disorders. Anxiety disorders often produce many unpleasant emotions, including distress, dread, nervousness, overwhelm, panic, worry, apprehension, uneasiness, fear, agitation, edginess, feeling disconnected, and hopelessness. Some common behavioral changes associated with anxiety disorders include avoidance of anxiety-producing situations or places, seeking escape from discomfort, commitment issues, engagement in self-destructive behaviors, limiting daily activities, over-attachment to something that feels safe, and difficulty concentrating. The physical symptoms of anxiety are implications on how anxiety is experienced within the body. Some examples can include restlessness, shortness of breath, increased heart rate, chest pain, sweat production, muscle tension, persistent headaches, hot flashes, chills, lightheadedness, dizziness, digestive distress, frequent urination, an exaggerated startle response, numbness or tingling, fatigue, sleep disturbances, poor appetite. Have you ever experienced any of these physical manifestations of anxiety? Emerging research suggests that both genetic and environmental factors relate and interact with one another to contribute to the development of anxiety disorders. Some of the risk factors include being female, limited economic resources, less social interactions in childhood, divorce or separation, parental history of mental disorder, close biological relatives with anxiety disorders, exposure to high stress environments, elevated cortisol, the stress hormone. The cause of these disorders, however, are still not entirely clear. Studies have shown that anxiety disorders are partially environmentally provoked and partially genetically provoked. It is also thought that some people have learned behavior that prevents them from experiencing an anxiety disorder. However, new research is being explored regularly to gain a better understanding of the cause of anxiety disorders. A visit to a primary care provider is often the first step to receiving treatment. The physical manifestations of anxiety disorders are easily mistaken for standalone problems. However, if it is apparent that the complications stem solely from fear and worry, a psychotherapist too has the tools to diagnose and offer treatment. Once it is established that someone is suffering from persistent anxiety, it is very valuable to proceed with a thorough mental health evaluation, as anxiety disorders often coexist with depression and other related conditions. Psychotherapy, which is often referred to as talk therapy, can help people who suffer from anxiety disorders. Cognitive behavioral therapy, CBD, especially caters to anxiety due to its model of encouraging a different way of thinking, behaving, and reacting to anxiety producing situations. Two concepts within CBD that are used to treat anxiety disorders include cognitive therapy and exposure therapy. Cognitive therapy's focus is on identifying and challenging the unproductive thoughts that are fueling the patient's anxiety. Then, exposure therapy focuses on confronting the fears that underlie these mental illnesses. Treatment may sometimes be prescribed by a medical doctor in the form of medication. The most common classes of medications used to treat anxiety disorders include antidepressants, anti-anxiety drugs, and beta blockers. Everyone reacts to medication differently, so a trained professional will aid in seeking the best fit. Luckily, if an anxiety disorder is not disabling someone's daily life, there are other treatment options beyond medication. A study from Johns Hopkins University School of Medicine revealed that meditation offers a similar benefit against depression as compared to antidepressant drugs. Similar, repeated studies concluded that mindfulness meditation rewires the brain's response to stress. All habits, positive or negative, exist by creating a strong neural pathway. That's a connection in your brain. Anxious thoughts and negative self-talk also act as habits for our brains to remember. Thankfully, the brain can change these neural pathways. Meditation does just that. And I can't speak enough about meditation. Meditation trains your brain to be less anxious by remodeling how you view your thoughts. Simply, how you remodel your house, you can remodel your brain. Meditation also teaches you to stay in the present moment, the here and now, versus harping on what happened in the past or worrying about the future. To live in the present. In short, meditation physically changes the structure and the function of the brain to make it healthier and more resilient against anxiety. Do you have any experience with meditation? On this slide, I've put some awesome guided meditations that are geared towards addressing anxiety. Caffeine, sugar, and processed foods all contribute to the overstimulation of your central nervous system. These substances often produce similar sensations as anxiety disorders, including heart palpitations, indigestion, and jitterness. On the other hand, the nutrients you get out of green veggies to feed the mechanisms that help combat anxiety. Switching out your morning coffee or mid-afternoon soda with a green juice or even simply water eliminates the issues associated with caffeine, and the added sugar while providing a nutrient-dense alternative. So it's win-win. Exercise is a cure-all treatment for many mental illnesses. It strengthens our ability to cope with stress. It releases endorphins and promotes better sleep health. These together are imperative when combating anxiety disorders. In fact, research has found that individuals who exercise regularly were 25% less likely to develop an anxiety disorder within 5 years versus those who were mostly sedentary. Doesn't that make you want to get moving? Yoga, with its combination of physical exertion and focus on breathing, is an excellent form of treatment for those who suffer from chronic anxiety. On the next slide, I've given you some resources, some videos and so forth to help you with yoga for anxiety relief. Yes, you're not alone. We're all in this together. Most people experience anxiety in their daily lives. Some are disabled by it, while others can ignore it. It is incredibly important to learn that there are differences in severity and everyone handles it differently. Anxiety is a complicated topic due to its complexity. However, the conversation matters. It is important to feel supported, safe, and aware of the subject. If you or someone you know is struggling with anxiety, you are not alone. There is a whole army of people learning to challenge their thoughts and accept their anxiety right beside you. I want to thank you for taking the time to experience this webinar, Anxiety 101. This is one of the most valuable events that I've hosted all year, and I feel so grateful that you chose to join me. If you have any further questions, please send me an email at dave@stevensgrouptraining.com, and I would be more than happy to help you out. Thanks for checking in, and I wish you all the best in the future.